Hi, welcome to our talk today on keeping youth healthy through positive parent engagement. We're going to be focusing in as well on parent engagement as it relates to adolescent sexual health. My name is Jenni Lane. I'm the Senior Program Manager at the Adolescent Health Initiative, and I'm going to be doing part of this talk along with my colleague, Gavrila. I'm going to move on to a little context here for the folks who aren't aware. The Adolescent Health Initiative, we're here in Michigan. We're affiliated with Michigan Medicine and the University of Michigan, and we provide training and support to health centers around the country who are working to improve adolescent-centered care. Our vision is to transform the healthcare landscape to optimize adolescent and young adult health and well-being. I introduced us, and here we are. So you have some faces with the names. So again, I'm Jenni, and Val is going to be presenting shortly too. So for our objectives, I want to just make sure that everyone knows what we're doing here. Today, we're going to be looking at strategies for engaging caregivers in adolescent sexual and reproductive health care. We're going to look at best practices for providing confidential services to minors. And then we're going to share some tips for navigating challenging conversations with caregivers of teens. So to set the stage, when you think about the relationship that a health professional might have with a young person and their parent or caregiver, it might look like this triangle, right? We're all kind of ideally each having an equal kind of part. The health professional has the relationship with the adolescent as well as with the parent, while a young person obviously has a relationship with their parent as well. So this presentation will hit on all of these relationships, but most importantly, how you as a health professional can impact this relationship. So that is that relationship between the adolescent and their parent or caregiver. And this is especially important when we're talking about ways to impact positive parent engagement for sexual and reproductive health. So first, let's define what positive parent engagement is. So positive parent engagement cultivates and sustains a healthy relationship between the parent caregiver and their adolescent, as we just talked about. And we're going to be taking a strengths-based approach today, but really I think that's kind of the positive in the positive parent engagement. So the strengths-based approach to caregiver and teen and provider relationships, which strengthens the connection between adolescent and caregiver while respecting and nurturing the emerging autonomy of the adolescent. So why does this matter? So we know from the research that the most influential factor in a teen's decision to have sex is parents. Parents can be partners in adolescent health, and we know that not just a teen's decision to have sex, but proactive caregiver engagement can help us build trust, help us to help them build trust with each other, so parent and child, or caregiver and child, and that trust also between the adolescent and the provider can provide better outcomes for us and an easier transition to adulthood. I'm also going to make a quick note about language. So you're going to notice that from here on out, pretty much always we're going to be using the term caregivers in the spot of parents. And we're going to use those terms kind of interchangeably, recognizing that caregiver is a little more inclusive. So to build on why this matters, so these strong connections can build this foundation, as I was saying, for a lifetime of healthy sexuality. So adolescents and young adults' ability to clearly state their needs, their wishes, their limits, when that is modeled in the relationship and reinforced in the relationship with both their caregiver and their provider, it can really build a foundation for understanding the nuance behind consent and kind of avoiding situations of coercion, whether someone is coercing someone else or being coerced. So trust also reinforces and increases the likelihood that adolescents will share concerns and be forthcoming with their caregivers. the likelihood that they're going to share concerns and be forthcoming with their providers, and the likelihood that adolescents will be open to caregivers and providers' perspectives, recommendations, and guidance. I'm sure there are some other benefits that you're thinking of right now too, and that's not an all-inclusive list, but those are some really nice foundational pieces. So this quote on this slide, the way that they talk about it, and the it in this case being sex, and the way that they're obviously uncomfortable just makes me uncomfortable, you know? So you're going to get a little more context for this quote in just a second. We're going to play an audio clip. And that's because in our work at AHI, we are really focused on supporting patient-centered approaches. And so we really strive to center the voices of youth. Throughout the rest of our talk, there are a couple of other times where we're going to be looking to youth voice to kind of inform how we're approaching this. So here's our first that will start us off thinking about the ways that adults communicate with adolescents about sex.
Like for me, I remember one of the first times I talked to my mom about birth control um, was I had like I don't know I had gotten caught doing something like bad. I don't remember what it was. It was like maybe I like snuck out or something. I don't remember what it was. But and I remember she was like really disappointed in me and she was angry and she like said like, oh, now do we need to put you on birth control too? And like that's something that like sticks with me like has stuck with me since she said that. Like our relationship has come a long way from that. Like I was able to like I have like the birth control implant and like now we have a more open conversation between us about it. But that was my first kind of conversation with her about birth control, and that really like made every conversation uncomfortable from that point on. Um, and then with providers, I think it's similar to like I felt like I had to like when they're like, are you sexually active? It's like yeah, and they're like, okay, how many partners do you think you've had? And like I always feel the need to like really like lower it than what it actually is, just because based on the way that they talk about it and the way they're obviously uncomfortable, um, just makes me uncomfortable, you know?
So there's a lot to unpack here in this quote. I really appreciate that this young person first speaks about the messages that she got early on from her mother that kind of made their interactions feel like she felt less comfortable talking to her mother going forward about anything related to sex and contraception, and also just that she felt judged, that her mother was kind of punitive about it. Um, and then also, she talked about kind of the importance or the feeling that she had that the fear that a provider was going to judge her for her amount of partners. And we know that adolescents can be very tuned into feeling judged. And they may come to us with apprehensions and expectations even before a visit. And we may have our own apprehensions and expectations, whether they're conscious or not. So this can be really important for us to tune into and to really try to mitigate and to kind of head it off at the pass. There's some really interesting research that's been done around the way adolescents perceive facial expressions differently from how adults perceive them, that they recognize kind of something that adults see as more surprised as something that feels more like the expression is angry. And so just knowing that young people may um, even if you feel you're being neutral, that sometimes they may perceive that as more adversarial. And so it's really important for us to kind of really focus on our body language and on being warm and open and accepting and reassuring and affirming. So what does it mean when we're talking about being strengths-based about sensitive issues like STIs and contraception and sexual health in general? So if you ask people to describe conversations between adults and teens about sex, this list is a list of keywords that come up. We see here a lot of things that are kind of speak to that trickiness of it and the discomfort. And then also some things that are more positive. And although these are the words that come up when you're having a conversation with a stakeholder, a young person discussing adolescent health, we have some control over this. So we have a chance to create a space where teens will come to us for support regarding their sexual health and be honest with us when they do. And we can change the dynamic from negative to affirming. So re-looking at this list, the conversations that we have with young people about their sexual health are necessary. They provide an opportunity for us to give important, accurate information in a respectful way to make a healthy, lifelong impact on our young people. Consider this question as we go through the rest of this discussion today. How can we actively commit to shifting away from the negative parts of this list? And what can we do to set a tone that is respectful and healthy? So it can be helpful to consider the implicit and explicit messages that we've received in our own lives, because socialization shapes us all. So take a moment to think about the messages that you received when you were growing up. Remember that no message is still a message, right? Especially when it comes to complex and contradictory social norms around sexuality. And we might have heard the word don't, but not actually received other information about what to strive towards. So we can also consider, when we're thinking about messages that we received, what intentional messages do we want to convey to young people about sexuality and sexual health? We have this chance again to kind of flip the script a little bit and filter out some of the socialization and some of those negative messages that feel punitive or shame-based, and think about what is important for us to convey. I want to pause here for just a moment too to think about how this relates to our topic here today and what we're talking about when we're talking about strengthening the relationships between caregivers and our adolescent patients, and for those of you who are not clinical, for the adolescents that you work with. So I think it can be really helpful for us to remember that we have this chance to model for parents how we can be sort of strengths-based in these conversations. And so that's partly why we're taking pause to reflect here on how we're conveying intentional messages, because parents and caregivers are learning from us by how we're framing the conversation. If particularly for those folks who there's like a power differential because of your role, often healthcare providers are seen as sort of those resources and authority figures, and as being trustworthy. And so if you are taking a tone that is supportive and affirming when you're messaging, then adults and the caregivers who are part of those conversations or are around for that can be learning from that. So in order to kind of put this to the test, we're going to look at some topics that might come up in the context of a visit or a conversation with an adolescent. So imagine a younger adolescent asking you about a topic like the HPV vaccine, and think about where you'd place your comfort level with the discussion within the circles here. So we'll look at a number of possible topics, and there's no right or wrong. This is for your own personal reflection. So try to be honest with yourself and thinking about what might make it hard. I also want to acknowledge that some of us may not feel willing or able to discuss a topic for multiple reasons, including our own lived experiences and past traumas. So here's sort of each of these bullets along the left, kind of considering for a moment how comfortable you are with each of these topics in terms of discussion with a young person. And then thinking about how you might feel comfortable or not. Would that change? Would your comfort level change if there's an adult caregiver in the room? Presumably, yes. It might change the tone of that discussion. And just how that might play out in terms of our comfort level. On the next slide, we're going to see a list of additional topics, and it's a pretty long list. So skim the list here to see which ones stand out as the most and least comfortable for you to discuss. Okay, so as you review this list, one thing to consider is that many adolescents know about these topics, maybe even know more in some ways than some of us. Many of them have questions or concerns about these topics, and some have experience with them. So this doesn't mean that they'll ask about them. So I'm going to ask some questions for your reflection. And if we were in person, we might pause for discussion here, but I hope you'll find that the reflection is still helpful. So is your first association with any of these topics negative health outcomes? Do we want our adolescent patients to feel that they can ask a provider or a trusted adult about their sexual health or about issues related to sexuality in all of its aspects? Like really answering that question, like, do we want them to really feel they can ask us about any of these? And why or why not? Are there any that we feel like would be off limits? This does depend on your role, and I recognize that there are people in this talk here right now who are listening who are not providers, but I'm just thinking about how this might apply to different roles. So in the context of a short visit, on that list, thinking about which of those feel like bigger priorities to address or not. So the slide that you're seeing right now just kind of reinforces something that I think we're all familiar with, but that traditionally our culture in general has framed adolescent sexual activity as morally wrong, inherently deviant, and with likely negative psychosocial and physical consequences. So even though most of us might say that we don't share these assumptions, they can be so embedded in our psyches that it's hard to recognize. We can see the residue of those traditional attitudes in some sex ed curricula and teaching approaches today. And this is probably not going to be a surprise to many of you who are involved in sex ed. Framing sexual behavior within the context of avoiding risk can make sense from a strict lens of prevention, but it also sends the message that sex in and of itself is unhealthy. The research supports that emphasizing harms may have a short-term effect for some younger adolescents, but on the whole, it doesn't change adolescent behavior for the better. Some teachers still use shame-based approaches like showing slides of STD infections, which undermines the message that many people can be asymptomatic, and it can also make students feel like their genitals are disgusting. Especially, as a former sex educator, I will say it was many years ago, actually, with in the late 90s where that was just such a typical practice, was to show the slides. And I just remember with each slide, the whole classroom going, ew. And do we want that to be the first time that they see an image of genitals? So also for many districts, sex ed consists solely of abstinence until marriage and STD education. One activity equates people who've had sex to chewed gum, with the messaging that once someone has been used by one person, they'll be ruined for sex with anyone else. I was looking at a grant request for proposals just recently, and I read a phrase that was kind of a priority area to address the problems of drug use, interpersonal violence, sexual activity, and other risky behaviors. So even just simply grouping sexual activity with behaviors that are inherently risky or harmful implies this inherent risk and harm in sexual activity. I'm also going to share a quick activity that I often did with adolescents and also with adults as well. I remember doing it with 7th and 8th grade middle schoolers, and then also with women who are incarcerated. And we called it an abstinence activity, but really it was something that helped people clarify what their values and expectations and what they deserved out of sex. And it was where just a simple exercise of having people list 10 things to be in place before they had sex. So, what would be the ideal or the aspirational? And it shifts thinking about what we want and deserve instead of what you should avoid. So that list might look very different for a seventh grader, a high school student, an adult, and that list evolves throughout a lifespan, and it's good to check back in with yourself. And so those messages along with that, I think could be like the spirit of that activity can be incorporated into discussions between parents and adolescents and other kinds of discussions with young people directly. So, sex positive approaches avoid moralistic value statements. They promote diversity in sexuality. They support the ability of people to make personal choices. They reduce stigma about sexual choices. They view sexuality as developmentally normal. And they utilize motivational interviewing approaches. So kind of looking at the points on this slide and remembering that when we're talking about the modeling that we're doing for caregivers through practicing these bullet points, both really helps strengthen and have more meaningful and impactful conversations with adolescents and helps adult caregivers be able to learn from that too. So I want to share this quote from Maya Angelou that is, I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. And that's a really helpful reminder for when we're thinking about these opportunities for setting a tone with young people and with their caregivers. So think back, if you can, to a negative interaction that you've had with a caregiver of an adolescent. It could be a clinical setting, it could be in a program-based setting, and ideally, if possible, thinking about specifically related to sex or sexual health, but if not, it can be just sort of a general one. And just thinking about what was frustrating about it. And what are some of those core issues for you that you feel like really touch a nerve when you're interacting with parents? What can be challenging? And maybe what's particularly challenging for you? Okay, so now that you've thought about that, of course you knew we were going to come at it from a positive angle. So think back to a positive interaction that you've had with a caregiver and what went well. So I'll pause for a moment while you can kind of reflect on this. And it's ideal if you can think of a situation, again, that relates to topics having to do with sex and reproductive health. And did you use any particular strategies in that particular instance or in instances like these? And what has worked for you in the past? What has worked well? I also want to acknowledge that we know that sometimes it is out of our control. So the power differential between parents and teens can make it even harder for us to feel like we have any influence over the quality of the interaction. And just acknowledging that that can be really frustrating and we can do our best. So we're going to talk a little more. Val, actually, my coworker, is going to talk a little bit more about this next.
Thank you, Jenny. Yeah, so now that we talked about the framework and how maybe interacting with parents or caregivers has worked out for you in the past or made you feel, we're going to dive into what caregiver engagement can look like. So you can see on your screen that these are the levels of caregiver engagement we're going to talk about today. And one or more of these may seem more familiar to you with depending on what type of work that you do. And just as a disclaimer, this doesn't mean that every caregiver fits nicely into one of these buckets. And this is really a continuum and based on a number of factors. And also on that note, just because a caregiver fits into one of these categories is not necessarily a bad or a good thing. It just affects the interactions that you may have with them. And obviously, there is no perfect caregiver that we're trying to get at. but we do want to talk about strategies of what interacting with these certain types of engaged caregivers may look like and how it impacts the work that you do. And I also recognize that, due to everyone's individual work environments, some of you probably do not see caregivers during your typical day. Others may see them every single day. So depending on how your work is, even if you don't see caregivers on the usual while working with adolescents, still think of how you could apply these principles or these strategies in your work setting. So on the left, you can see we have the under-engaged caregiver, which is where maybe the caregiver connection is lacking here between the adolescent, the caregiver, and the provider or the healthcare professional. And this may look like a caregiver that you never see or that you're trying to get a hold of, or that you're trying to encourage them to do more in terms of taking charge of their teen's health. The middle is the parent-teen partnership, and this is kind of the ideal relationship where the teen and the caregiver have equal responsibility and investment in the well-being of the teen. And finally, the over-engaged caregiver is someone who typically takes control of the caregiver-teen relationship and gives little independence or voice to that teen. So we're going to dive a bit deeper into each of these categories, and we're going to see how it can impact the specific aspects of adolescent care, starting with how does an over or under-engaged caregiver affect adolescent care, especially when it comes to sexual or reproductive health. So when you have an under-engaged caregiver, you may notice that the patient that you are seeing has a lack of support or guidance from the caregiver. So this may be the parent being on their phone throughout the visit. Another issue that could arise is that as the provider, you're only getting a one-sided perspective on a situation because you can only talk to the teenager, for instance. So obviously, you want to trust your teen patients, but teens are still developing and learning, and there's a certain amount of information that a caregiver could fill in the gaps for. So for example, you could ask a teen, are you taking your birth control pills every day? And they would say, oh yeah, of course I am. Where if the caregiver was present and engaged, they may say, well, you've told me that you've forgotten them in your purse a few times. Additionally, if you're encouraging your patients to connect to services, you can get frustrated by the lack of action on the caregiver part, especially when it's necessary. So sometimes parents are uncomfortable with their teens being sexually active, which is totally understandable, but they may disengage and say something like, this is on you, you're responsible to getting, to your appointment for your shot. So while it's okay to be uncomfortable, this can also come across as criticism and discourage the adolescent from taking responsibility. And it can also mean that the caregiver is withholding support for things that are really critical to supporting this relationship, such as, if they're withholding support to give a ride to their appointment to get their monthly depot shot, for example. On the other side, a caregiver that is too invested in their adolescent's care may pose its own challenges, such as refusing to leave the exam room, which would not allow for a confidential time with the adolescent and provider, which is crucial for the teen to bring up concerns that they may not want to talk about in front of their caregiver, which is understandable, such as STI concerns, or just other questions that they may have about sex that they don't want to ask in front of their parent. Again, additionally, if a teen is not able to talk to their provider alone, they're not learning the skills of advocating for themselves and learning some independence in that process. So it can also affect the relationship with the provider and teen. If the caregiver is always the one doing the talking, the teen is more likely not to bring up their own concerns if they just know that their parent or caregiver will do it for them and they're unwilling to have their own conversations. And so this is just a couple examples, but there are of course other ways that this can show up in your work. So if you want to think to yourself about what else would you add to this list, or what else have you seen in your work of how an under or over-engaged parent has shown up for you. So we're gonna take a second and watch this video, which highlights how teens can be their own advocates in healthcare, but also shows a great example of how caregivers are part of this process.
Hi, I'm Lanique, and I'm on the Teen Advisory Council at the University of Michigan's Adolescent Health Initiative. And I'm here to show you ways to get the most out of your healthcare experiences as a teen. As much as doctors, nurses, and clinic staff want to help, it's also up to you to make sure you get the care you need. Let's drop in on Taylor and her mom visiting the doctor.
So how are you two doing today?
We're great.
All right. And you're in for just a checkup today?
Yep, Taylor just turned 16, so it's time for her exam.
Oh, does that mean you're junior, Taylor?
Yep. Yeah.
All right. And Taylor, how are things going for you at school? Do you play any sports or anything?
She's really good at hockey, and she is thinking about doing Glee Club, right?
Oh, do you like to sing?
Love it.
Okay. All right. And socially, how are things going for you? Do you have a lot of friends, big friend group?
She makes friends really easily. She's got a lot of friends.
Okay. And Taylor, how about your classes, your grades? How's that going?
I'm doing okay, but I've got a big math test next week. And is it okay if we talk alone?
Yeah, sure. We do like to touch base with our teen patients for a few minutes by themselves, if you don't mind.
Okay.
So I wrote down a list of a few questions.
Okay, fire away.
I'll start with the top 10. Can I tell you things that you won't tell my mom? What's covered in our insurance? What about birth control? How would I get an STD test if I needed one? Am I getting any shots today? How can I get in contact with you privately if I have other questions? Did you always know you wanted to be a doctor?
Okay, let's break this down. You can see that Taylor's mom was stealing the spotlight. It's not her appointment, but some parents have a hard time letting go as their kids get older. Taylor was clearly getting frustrated, but she kept her cool and she arranged some time to speak one-on-one with her doctor. She brought a list of questions to help guide her through her appointment. She made sure to find out the doctor's confidentiality policy so that she could feel more comfortable being open and honest about her health concerns. Also, many health systems now have electronic patient portals to make it easier for you to manage your own healthcare. You can log onto your private records, send a message to your doctor, or even ask a question. To get started, you'll need an activation code, so ask your doctor's office. Now, let's drop in on Jake for a checkup with his doctor.
And finally, it seems like you're due for your HPV vaccine, so just let me prep this shot and we'll get that taken care of.
Actually, could we wait on that a little bit? I'm feeling a bit worried about this.
What's going on?
I don't do super well with needles.
Oh, don't worry about that. It's very common to not like needles. What we can do is ice the area a little bit so you don't feel it going in as much. A lot of people like to be on their phones just to distract them. Or we could even bring in someone to hold your hand. We just want to make sure you feel comfortable.
Cool. Is there any side effects to the shot? Yeah, I don't really have insurance.
Jake's situation brought up a few things. When he said that he was feeling anxious, it allowed the doctor to slow down, answer his questions, and make sure he was feeling comfortable. Every person has a right to know what is happening to their body and to have a say in their health care. Medicaid, which is an insurance plan under the government, may be an option if you don't have coverage under your family or work. Also, some health clinics may have sliding scale fees, which means that the services are based on income and can be low cost or even free. As for payments, there are no costs for vaccines for patients under 19, but there are costs for other services. All teens and young adults deserve quality, confidential healthcare services without judgment, but sometimes we need to advocate for ourselves to make sure that this happens.
All right, so one in that video, you probably noticed though, is that where would you place this caregiver on the engagement scale? Well, I think it's pretty obvious it was in the over-engaged parent. But also a fun fact about that video is that it was an AHI production, and you may have recognized that parent as our very own Jenni Lane. So you can see that we use our own resources and staff members sometimes for our video. So thanks, Jenni, for having that cameo in that video. All right, so thinking of that scenario that we just saw in the video, so what strategies could the provider use to move from that over-engaged parent to more the middle of a caregiver-teen partnership? So in this case, in the video, even though the teen advocated for her own time alone with the doctor, that's probably not going to be the majority of teens or the majority of situations. So the provider could have at minimum asked for the patient to answer the questions without the mom chiming in, and even better, have asked the mom to leave so the teen could have some alone time. So to do that, he could have acknowledged the caregiver's investment in her health, such as saying something like, you know, it seems like you have a really strong relationship with your daughter, and that's great. Our visits can be an opportunity for her to build her own independence. So I'm going to direct most of my questions to her. Even better, this clinic could have had a workflow to improve this process for the clinic overall. So the provider didn't even have to run into the scenario at all. So such as having the caregiver wait in the waiting room for the first part of the visit. And we're going to show you an example of how this may look next. So again, as you can see from the quote on the slide here, this is something that a medical assistant at the clinic might say. It might intercept the caregiver coming back for the patient, coming back to the patient room when, even before the visit starts. So especially if this is a healthcare policy that, you know, the MA could say something like, we do this for all our patients, or we do this for all of our teenage patients, and then say the script, no, we're going to ask you to wait outside while we encourage the teen to come in to discuss their own view of their health. And this is really important if you use that standardized language, because it avoids making the caregiver feel singled out. And instead, it frames it as a clinic policy and it is being done universally. And two, it's really, instead of being kicked out of the room, it's just showing that they want to hear from the teenage patient themselves and hear what they have to say. Another strategy that a healthcare center may use would be that you could be proactive and send letters home to caregivers of teens that gives them a heads up that they're going to be, you know, when they come in for the well exam or their annual checkup, that the teens will be roomed alone to talk about their own view of their health. And especially when you send a letter like this and it gives the outline, it clears up what types of, you know, questions or topics that will be discussed. That really can mitigate the confusion or the unknown idea of what the provider and the team will be talking about. And, you know, depending on what the state laws are in that clinic's state, you know, it can also give a brief outline of confidentiality for teens, and also reassure the parents that if the teen discloses that they're, you know, in danger or putting others in dangers, the provider will share with their caregiver. And for other sensitive topics, you know, we'll just encourage the teen to share with their caregivers if it's appropriate. So this sample letter that you see here is actually an example that HI has from a starter guide, and we'll also mention our resources at the end of the webinar, but this is something that's easily found for free on our website if you're interested. All right, so we're gonna walk through a case scenario. So in this case scenario, you are a provider and a 15-year-old young man comes in for the chlamydia test and is worried about his caregivers finding out. You explain that you can do the test, but there is a chance that his caregivers may see that he received an STI test on the explanation of benefits if he uses his caregiver's insurance. He agrees to do the chlamydia test. Later that week, the caregiver calls the clinic and demands to know why her son received a STI test. So, as a provider, how do you support the caregiver and the patient in this scenario? If you want to think about this, we're going to come back and we're going to share some strategies first of how you could handle this. So this is a situation that I'm sure many of you either have encountered before or fear encountering or have, you know, to different degrees experienced this in your work. So even though this may feel like a tough spot to be in, there are a few strategies that you can use to make this a smoother conversation and set yourself up for success. So you can see that we have on the side the best practices for confidentiality split between caregivers and for patients. So starting with caregivers, so when you do get that phone call, you can be supportive of the caregiver by first stating your clinic or state's policy around confidential services. So obviously, let's just pretend in that scenario that, you know, obviously the provider could do that test without parents' permission. Just instead of answering the direct question of, you know, why did he receive the test, like, just stay in the policy that, you know, your clinic follows state laws that they can do, have X number of confidential services, but, you know, for the young people coming to that clinic. And secondly, also encouraging the caregiver to have a conversation with their adolescent and connecting them to resources to navigate those conversations. So using phrases like, I understand that you're concerned and you want your teen to be safe and healthy, but under our state's confidentiality laws, I can't disclose the test results, but I can encourage you to have a conversation with your, son and share your concerns. And if you like any resources, feel free to check out, and then you can name websites. So really the fourth bullet point listed on the left there, active listening, is really one of the most influential tools that you can use for parents. It's just having those active listening skills and understanding that, they probably just are concerned about their child's health. But at the same time, you want to be supportive of the patient that you are supporting. So moving to the other column on the right of the screen here. So supporting confidentiality best practices for patients is counseling all adolescent patients about the protections and limitations of the law. And this is something in the scenario that the provider did, right? They said, well, you can get this test without your parents' permission, but there's a chance that it will come up on the EOB. So he did let that be known, and the young person chose to pursue it anyway. So again, using this as a standard practice and counseling all patients about what the protections are. Also, obtaining a cell phone number for all teen patients and using a standardized system to collect this to make sure that when you all are communicating with the young person about either their test results or scheduling a follow-up appointment, that you're speaking to the teen directly and not having to go through the parent if it's confidential services that they can obtain on their own. Again, even clinics that have who don't have a standardized system but have maybe somewhat of a system, the cell phone numbers can easily get misplaced in the chart, and then all of a sudden it's oops, actually you need to talk to your teenager, not the parent, and then it causes concern. So just having a standardized system could really circumvent that from happening. Also, as a clinic, instating universal chlamydia or STI screenings. So let's say your clinic, if all, once you become a teenager, every year you get your yearly, STI screening. That could be also a way that you can tell the caregiver who's concerned. You're like, oh, well, you know what? We did this because it's our clinic policy to screen all our adolescent patients, and just leaving it as that. And the next bullet point of training all staff and providers on practices, policies, and legal protections. Obviously, when a young person comes to a clinic, they're interacting with more than just the provider. They're going to the check-in desk, they're probably seeing the medical assistant, seeing a provider, and maybe someone else in the staff as well during a typical visit. So if those 3 or 4 contact points, they may ask, the MA or the front desk person if they can have this service or whatever questions they may have. You want to make sure that all the staff working in that clinic or in that organization have those answers so they can provide the young person with the most up-to-date information and know what, put the young person at ease. If they're asking that question, they already obviously thought about it and wanted to ask someone at that clinic when they were coming in for their visit. And then also things such as having robust referral lists for sliding scale services. So let's say that young person in the scenario did not want to do that STI test because he did not want to risk his parents finding out at all. Well, you, as a provider, you want to refer that person to somewhere where he can get those services. So having, sliding scale clinics available, or having just a sheet that you can hand out is really helpful for the young person to connect the gaps there in care. And again, just making sure that young people have access to information about confidentiality laws. So things like wall posters or handouts explaining confidentiality laws are making the young people just more well known of what their rights are. It can also be a good heads up for the parents or caregivers in the clinic of being familiar with the laws as well. So it really benefits both parties there. So again, we just talked about what the best practices for confidentiality are, and to really highlight why they're so important are, adolescents are more likely to disclose sensitive information if they have the assurance of confidentiality from the provider. So again, either it's from the provider saying, yep, you can do this, or, if you have the service, you don't have to have your parents' permission, or just reading a handout of knowing what their state's laws are around, STI testing or access to contraception. Again, so many teens don't know that they're able to access certain services without their parents' or guardians' consent, which is why making that education handout for teens so important. All right, so this is a quote from a clinician, and this is about how they approach bringing up tougher conversations in clinic with caregivers. So this, you can see on the screen, I'll read it out loud. So after I ask most questions and do a physical exam for my, let's say, 12 to 14-year-olds, in the end, I wrap up with saying, this is something I discussed with all my patients with the caregivers in the room. And this may have been the discussion that you shared with your child already, but I think it's important enough. And if not, I am opening the door for you to carry this discussion further. And then they say, I don't ask them if they're sexually active in front of their caregiver, but I can mention your friends may have been, and these are things that can happen, and you need to protect yourself. So you can see, like with this quote, that they're doing a couple of things here. So one, this provider is using the universal method of saying, I do this for all my patients. So it's not singling the adolescent or the parent out. It's just providing, this is the standard of care. And it also, the way that they have this conversation at the end of the visit, it also highlights the importance of the caregiver and adolescent having these conversations and encourage them to continue this conversation at home. So the provider is providing a window of opportunity to discuss, with them in clinic between the three of them, but also to carry this conversation for further discussion outside of the clinic walls. And that's something you think about back to the triangle and the beginning of this discussion. You saw how the provider, the parent, and the teen are all working together, and how you could really influence the parent and teen relationship. And third, also this approach of taking the pressure off and using a third person's perspective of saying, your friends may have done this, or that's something that they may happen to them. And it really makes it easier for both parties to talk about maybe sex and reproductive health when it's not directly using them as the person of interest, right? So not the young person saying, well, I've been curious about this, or the parent having to talk about their own child's sexuality and health, but putting it like in the third person perspective can really just make it easier to talk about. All right, so I know that was a little bit clinic heavy approaches you can use in clinic, but there's also strategies that can go beyond the provider-patient relationship and beyond the clinic walls as well, especially if these strategies can be useful for any community-based organization that works with adolescents, if it's clinical-based or not. So other strategies to engage parents, if it's not in that conversation at the end of the visit, is inviting community partners who may provide health services for young people and or other services in the community to either your location and talk about their mission, services, and partners. So they have a face to the name of what other resources may be available in their community. And also linking family members to either school and community programs that promote health and safety. So again, one thing would be to invite them to talk about the services. Others would just be to linking them. So they have now the face to the name, as well as many other options that you may have a referral list in your clinic, which I'll give an example in just 1 second. Other ways you can meet caregivers where they're at. So again, thinking of expanding where maybe you are located in the community, going outside of your walls and, meeting caregivers if it's at a faith-based community, libraries, restaurants, grocery stores, and having an event there. It was just getting to know your services or setting up a campaign. Especially during these times, maybe going out in the public is not the best. So this is where virtual meeting spaces really can come in handy. So either setting up, at a convenient time for parents, after working hours, if you want to do like a Q&A with your clinic or a Q&A for your organization, or put on some themed workshop, you could do that. We're all pretty accustomed to virtual meetings now, and that could be a way to reach caregivers, as well as using social media. So again, advertising on social media for, this upcoming workshop, or just even serving parents on social media, or just highlighting what your organization does is a great way to engage parents who maybe you're not seeing in the door face to face. And then also providing materials and services for non-English speaking families is also always a very important strategy to keep in mind, to make sure this is really dependent on your patient population, but making sure that the services that you are providing are accessible to all. All right, and another approach is going directly to the source and surveying parents on their satisfaction with their child's health or their services that they are receiving. So again, maybe you're not going to see a parent face to face or even virtually, but you could still get their opinion through surveying them. So again, this is especially if you're in a place where you never see parents face to face, if you're not seeing parents come to the clinic with their child, or if you're just not interacting with the parents, sending out a survey link, or you could do this by paper as well, of really making the survey specific to what their parents' views are on their child's health or how their child is doing in this organization. So you can see that this is a sample report card that we use in one of our resources, but it's giving a grade to how is this clinic doing, like for scheduling, appointment times at convenient times, or is the information helpful, as well as having a section on, maybe asking what areas do you want as a parent. So this could be, if you're looking to have a sex education webinar or reproductive health webinar or some kind of workshop, this could be a place that you can get feedback about the particular services that you are serving adolescents for, but also help plan your programs for the future of oh, we see that there's actually a really big need in the community to, how to talk to their child about sex. And that is something that you can easily, use this direct feedback to do for your organization. And also, I just want to highlight another resource here. This is an AHI resource as well that we have available for free to download on our website. And this was one of those strategies that we talked about in a few slides ago about linking caregivers and families to services in the community. So, like we said, maybe you have that teenager who does not want to use their parents' insurance, so they don't want any of this information to even possibly get back to them. Well, you're going to need to refer them to a free or sliding scale clinic. And maybe in your area, there's maybe 5 of them. And maybe that of the 5, that 4 of them are really focused on adolescents and, whatever it may be. So this is a template that you can put those organizations in and use these easy to use check marks of is free or low cost, or has after hours services, or whatever those categories may be that make it appealing to adolescents and their families. And additionally, this is also great for adolescents, not only for themselves, if they're going to take health into their own hands, but also to meet any tangible needs of a family. So again, thinking back to that maybe under-engaged caregiver, maybe it's because they're just have so much on their plate that they're trying to deal with maybe food assistance or housing assistance or whatever it may be, but just connecting families to other resources that may be out in the community to help bridge those gaps in care, and also just really have a one-stop shop if they're already in the clinic door of the organization to know what other resources are out there to make it a little bit easier. All right, so now that we talked about some strategies, I'm going to turn it back to Jenni.
Thanks, Val. And I'm going to be sharing a few resources for us to close out this talk. So I think one thing that's been helpful for me when I've been thinking about ways that I look at my own biases about adolescence and sexual health is to do my own education. And one of those ways is I am on Instagram, and so I follow some great places that are doing really good work around sex positivity. And one is Sex Positive Families. They regularly post either short quotes or strategies or just thoughts that help me reframe the ways that I think about sexuality and adolescence as well. There are a couple of others that we've listed here. Teen Vogue does some great work around destigmatizing the sort of shame-based sexual health messaging. Erica Hart is a sex educator who does some really great kind of radical work here that really can help us expand our thinking. Mentioning also down at the kind of bottom left corner, the slides that are up there on the left-hand side that are about internalized STI stigma. Emily DePass has done a lot of work around destigmatizing STI infection and STIs, and she posts a lot of stuff on social media. Also, we shared the video that you saw that I had that cameo in, that I want to say thanks for the shout out, Val, for my acting chops. And I'll just say that as a parent of two teenagers myself, it was pretty easy to channel being an overengaged parent. And I just wanted to add on to kind of some of the things that we've talked about related to how parents are navigating their own anxieties and fears as they're seeing their young person, their child, emerging as an adult. And it can be really scary, and thinking about them engaging in things that adults perceive as adult behaviors. So we want to just acknowledge that. So this slide shows not only a couple of video snapshots just that we have on our website. We have a number of training videos there. One is kind of focuses also on those challenges that I was talking about for parents in acknowledging their adolescents' emerging independence and supporting it. The poster, too, this kind of brightly colored big poster that says "Take Charge of Your Healthcare." We have a number of different posters that are available for free on our website, so you can either download them and print them, or you can request them from us and we'll ship them to you. But this one in particular really feels relevant to our conversation around parent and caregiver engagement. And what it does is, both for caregivers as well as adolescents, it normalizes these sort of stages or phases of ways that adolescents can gain more independence in their health care. Kind of like a vaccine schedule that can be posted, right, where it's just like, here's what happens at this age. It normalizes that parents will step out of the room, or that it's not only appropriate, but a good idea for young people to have time alone with a provider, for them to know their medical history, for them to talk about, bring up their concerns to their provider, making appointments for themselves, etc. We also have a handout for parents and a handout for teens that goes with this poster. So those resources are free for download on our website. Another kind of resource I'll just point you to, and our web address is down below on this slide. We have starter guides, which are essentially like mini toolkits that are actionable, that focus on various aspects of practice change and improvement. Most of them are clinical based, but some are also focused on community-based organizations. And then some helpful national resources that are out there. The CDC has a guide for caregiver engagement for schools, with a lot of relevant information there too. Society for Adolescent Health and Medicine has some resources for adolescents and parents. And the NIH has some great resources for caregivers about healthy communication with their adolescent around sensitive issues, and includes resources and trainings. I'm going to add one on here too, Val, sorry, I just realized we did not mention Patch, and we're talking to y'all in Wisconsin, and Patch is a Wisconsin-based organization which is physicians and teens communicating about health. And they've done some excellent trainings and have developed some really nice resources around minor consent laws in the state of Wisconsin. So what minors' rights are for confidential care, where those limitations are, and what the sort of protections are for them. So I recommend checking those out, and you can also reach out to us if you have any trouble finding them. Sorry that I just remembered that great resources. I had to just do this little add-on for them. And then also Val mentioned that on the HI website, we have resources around minor consent and confidential care. We do have trainings that have been developed for the laws to reflect the laws in Wisconsin, and those are available free for download too. Okay, so now for reflection, I'm just gonna pose these questions here, recognizing that you'll have the opportunity to do a live chat with Val, my illustrious coworker. I will unfortunately be unable to make it to that live chat, but I'm hoping that you'll have a moment to think about right now any questions or concerns that you still have, situations that we didn't cover, and what types of situations are most concerning to you. So this can be useful both for sharing any questions in the live chat, but also, I guess next slide, we'll share our email addresses. So if you have anything that came up for you in this presentation that you want to reach out to either me or Val about, please, we'd love to hear from you. Feel free to email us with any of those. And then we have our references slides. It's going to be a part of the slide deck that I know you'll have access to. And we just really want to thank you for thinking about these issues that can be really challenging, and we know that there's no sort of silver bullet answers for them, but we know we are always working towards seeing the opportunities of strengthening caregiver relationships with adolescents in that sort of triangle that we talked about early on, and really just laying that foundation in all the ways that we can. So thanks for joining us today.